Are you thinking of owning your dream homes? EJ Investment is here for you. Secure our quality bungalows with 2, 3 or 4 bedrooms, or our story buildings 3 or 4 to 5 bedrooms at very affordable prices with flexible payment plans at our Sanyang Seaview Estate, where you can enjoy the cool breeze with modern infrastructure such as tar roads, covered drainage system, modern electrification with street lights, gated entrance with security posts, and social amenities such as gas station, shopping mall, medical clinic, park, schools, children daycare, and a lot more. Our dedicated team of professionals will keep the estate clean at all times, provide security and patrol team within the estate premises, install latest technologies such as CCTV, Wi-Fi, home network installation, solar panel, and power backup system. Also, check out for our additional home facilities and interior design service such as premium tiling, wall plaster, home landscape, fingerprint home lock, and a lot more. Visit our office at Senegambia Kololi Highway and get a free site visit tour, or contact us on 4464-838. WhatsApp us on 3259220. Or you can visit our Facebook page or Instagram on EJ Investments. EJ Investments, we are first in properties.
Mbadi ngolu mini ben lamoy kan ani mini ben jibe kan mbenta jangin somanda pour ka ngol le di jorangol le di Brikama lopitano la on behalf of Brikama Seattle Society. Na bengoto jang ila president o bijanne mumu Babakar Njai ti Panjai, ila Brikama reps fanang mi bijang Baro Touré bijanne nte fanang bijanne Demba Yabo mbe modol fana yilla ka min be ko Alkali Sambu and others. Bimu doku ngoti nyami molbe mannano bare Babakar bijanne Fabu Sane fana muila kafo molati o fana be silo kannane anin sibi karang wol bebe silo kannane. Bi nyin somanda na taw bengol la jang lafta pour ka bengo nyin dayle duwa la folo nga duwa fo ala se baraka ke nyin kuoto ye hamol ministre to Brikama loptano ya nim Brikama sate o ya nim banko e fo ala sa akere no nyin bi lungo horomo kamala ani nyin karo horomo kamma so nga duwa folo nga bengo nyi yele ko nga fo nyamindo amin alamale na duwal jabi ko bin na bengo jang wala mu ka fengol jodangol min yalon ko Brikama society e iskina jam pour que prison hospital management bulu Brikama jang mbe bengo folo la min na wala kayla in charge nyin kuma ne memu la min sanyanti pour ase la mol introduce mol min bi jang pour nyolo ngo kamala
comme ngana kontano ko tanda la damento wala kata Brikama association in Seattle wolle buluma fengol sambanan loptano jam min kata loptano sula fembate benyin tembo min kono dañu watola ñaatili ñaala jam fengol men be loring be ngalom be corona la watol te bagasol le sambangena men yalon ko kumaya bata corona la karola wala kata N95 face mask te yow sambangena ne ye sucorin kitsol sambana glofo fanan nata ko fendi mi yalon ko hataji sularingala in fact ngamera janne nyim presentation de ngafunu Mr President kay control ba dat la le ka use dol nga dat la fongo ka use because ayatara tembo men abe futala glofo bantambul le feren sa intente ngawo use o datele wolbe jele inatana trauma kit sol fana samana wala nyim mol men boy accident to men katita ila kulul jorangol min nyante mako no la pour ka kulul dada ke singol dada yol fana nadu wol fana be to je nyanta nyim pagasol le dilan na jang bari mbe murula koma demanding because ni association o ni tol ni metale e meta demaro di la loptano la le demaro di fanna jamal la loptano kono jang na bengo kamala nko sai simuru ko mango ko dol satano mole mini makalamta ko ni association o nanaka fengol mini kanyu loptano because wol dol kakale aka camera komale camera buga taraje journalist wol buga taraje pour ka ko nyin janjandi mole ya fahamo nyama o demarol kono ye mininata ñi loptano to la demar kuma folo la oktara ke mente wolen na wulud lato wulud lala al halo be nu nyamen men ya jenung anen ni nata je say ifonkalon ko falungo keta je lo falendrol men be keta je Brikama Society in Seattle wolle o demaro ñing ke je ye lebo wo dada ya be ñi ñande ya be tile ye wolol dada nye na pompol ni kurangol be dada nye je alhamdulillah say fonka ndol fananka foko maybe we are second to one in the Gambia, that is Jambe Foundation. Wakata kontane kubati. Wokola ila demar domi nana ya ke loptano wole na muchuari nyenti ngalon ko muchuari fangola lo e buloba kotole e kuma kangol mindi fonyo watu mantara jang bari frijo membe muchuari to sa nga furawol ka min kono e tolle ya sambanang ya fixinye muchuari to jam furawol ka je mi yalon ka e fo kembala to da ko fure nanta sinya clean ko manto num fanan akatanye sola kodi pour ka cour la masingol soto natana cour la machine fula sambangena ninjar la machine fula wol bebe nun laundry le wol be lo taje bar comme nga fala na me ñun doldu mol ma kalamta ya kananne ya ke ala kan kila kan because man camera bulanda no me man fem bulanda no ma bar say wajibo lente kan nga fo because ay tol nga muna fa nga sotala le nte sa fono la hani tol man la fa fola wala be mbula fola o kola no bataje natana trauma kit sol sambanan jang o trauma kit sol wol lebe larin jante comme nga fale nyama mol men yalon ko e katol soto e axangol soto wala ka muna fanno nyine ke la kol dadane wala ko manto num fanan ye larangol sambangena hospital bed and hospital mattresses me yalon ko ketanye sula ko wato la birinni kachata ye sambangena natana na larang kotol bonde me yalon ko mol men ke la larangol kan ke batande je ngol falin wala larangol la hanbi wolbe lal tole natra wato balbulu nsi yay no la aliyeji be e botaje kote ke ko personal men ke la larangol kan wodol kono men kana outpatient e katara siri e ko woto television fana nyanta sotol mi yalon ko wasi pleno yele saje fana hanebe lobdare lobtano kono isalo munebe tama kan dunia na dandangol la ina tana television setol sambangena men yalon ko nge fixe be dulal to tari mbi numbara la baka wala fana nane wo fana kenye janne sola ku dobe je hansa e mbo ko konole bari jam fata ko konole wala sola projet o nyenti e mbe ngalo ne kuranko be banko kan jannyami e fanan natalo e ko ba jela ko loptano especially labor ward anin tiata ko kuran kana faje e natana solar panel jama sambangena sa intending solar panel tallu ni lulu wol be selende tala bebe santole e ko battery be santale technician o fanga natale ndo fanga jele nakata tale ngadula identify wol be nyanta kala daminto slow badan wala nyanta nala pour ka kuran nyim fix battery ning fonko nyim fix nyo bala saing bado fongo be silo kan nan saing because e kabe Europe le saing so njikita ko very soon abe futala banko kam pour ka nyim projet ko nyim projet keta e bagala hanin nabe ke kuran samba suto to man doba to no sol ni sasa tol ni doctorol men be do ko rat lal to tare wolte batala bare beddaniro keleye bari to la hamon ko nyinte pour ka lebo wot anen tiata nin sa kafundi no dula ko ton to min be yalon ko ka do ko ke suto na tara asembo sano nga extension o ke wolto min be common lab because lebo wot nen lab la kata nyola e general wot fana mol katara jele outpatient department fana mol katara jele suto ning asi demaro ke no kurango e futa wolto Mr President o ben kontan na bakala o wokola la si na loptano anen loptano la senior management team anen loptano staff o mo be anen regional office and the Ministry of Health Mr President through you lafta attendila alla association of members all bela minni bebeje minni ka ke doko ke bala jato la minni ke la kodo bonde minni ka wole kata daniro la minni ka ko be kaje be numbara la ko bagasol min alke be kina nyajang alhamdulillah ke sotole e be loptano konole dol mo consumable to minni yalon kon ke use la wala batine to dol jela sai but those physical ones minni man ka consumable te nal pare dan sifutano la aliyeji be wala ka sor la fanan kontan aliyalon ko be damento o kola mba fala ala baraka bake pour wato beta kam modo sena diamola
na staff men fana be loptano to jam mbe be kontonna na president ba member nan siatu memu panjaiti ndefon ku kenyo ba mba attentula mba jayila mba fala alhamdulillah rabbil alamin nyimbe ngo kumayata bake na president bale nyanta kachanyin kumfala bar nte lafita danire ndi nekk la jang molu la men yalon ko e be Gambia e bantala adum Brikama dingol le muti wala Brikama silal le muti nyin bengo membe jambi nyin nafa ngamoy ngaje ko albe yalla moy le in charge membe jang sanyang ay memfo woto mbe commandiro kala Brikama dingo mumwela ebe dunia dawoda walla men sita Brikama jang ebe dunia dawoda ne ayata ese katake ye kafunyin kafomano kanyi kayiri wandrike nyim programme men bake kan jallo pitanoto me ya kummayandi wala nyinti ko Gambia bankole sulata de marola adum bankudi wo bankudi ila nyantole mu ye fanyininka nte mu ne kenna bankoye e be men kelen na banko ya nyanta commencer dulala sotola wala mo iwulu dulato wala sidulato iwulu ta damento ila alfal ni molle denta ye community service ke o community service ol kono ita fanan karanta wala to e karanta karambo men fanato kotake banko kan karakara wala molye namol le jo wolle o karambolu sponsor foyete karang sutunoje ni natana na yirwa sotela balwo kono ifuntita Gambia banko kan e ka fenkeno la alfalie a nyanta nyinyala ye fa nyininka wo jama men nintel alfali sita nyokan fontenga environment soto non 40 fon funtita no bi katine soto nte ka mone samba o jama kan membe o molu de fala men yalon ko wolle nintel alfalu denta yen namolu jo ye community service olke local service system so mbe commandro kala walla ko ale mbe ngaden ngaw julojo nyin e bukake ete kungaye e kake men kama wala nyinte ko jumale be nafala nyinna e mo marilo fembe jamme alon ka simo nafa men bota basse ma fa wala men bota kiyam ase keno wumunte la wulula kendelati barana men sibri kama sato ko mo na mena mirako abel kusot la nyi jalneto membe kala mantorata la demaro abe osot la nyi lopitanol to ado do mar demar joran osina ke fenti me alon ko abota nyi society le bulo ka samana Brikama jang men kamanta ko accident walla yen naaje me yilla fen la hajul marché kono dron sa sifa nyamoto boy kan ye samana jang ye nafa soto nyim fen joran la jang walla ila moy baybulu jang ila soto la kanya o kamma ima nyamoto sambano ila fata sambala damento ya samana nyim mu ci wari to jang ya ke frijo kono ay laaje ete sila haji ko tan topato e sina sambano ate torala asi kede mari bati me alon ka fotata moma men fenke jang wota kete asike wajiboti mobe yenyin kanuko ite be fenne kala duniya me alon ka be moda handila me alon ko anamena sule bul fenna anamena e walin fenna bar alal la nyino kamma wayatinna ala e budal abalatele nemo kono men nemo alon ko asikete joti duniya jang asiketo e joti lakira woton tidiya mo jam fanan bake ñine mun na ko moto do lafta jande na president bamina ngani encouragement di mennu bake kan ala baraka al nimbara momo ni be ñun dulale to dron katake ye dake je na sibi karambe jele lamine jata buba jata ñulbe atebanna ke kendo siata ota la baraka bake mbe chanti dilan president bala asi kacanyum kumfa bari wato metante letalu manden traffic last.
Thank you very much for that brief introduction. I wanted to speak in English for the benefit of our donors and and for people that cannot understand Mandinka also. It's a pleasure being here today doing this presentation. First, I just wanted to thank our partners in the Gambia here. That's the ex-people of Brikama Primary School and also Badimbung. We work hand in hand with them whenever we send this equipment to the hospital. So their reps are here. Dembayabo is here, Baro Tura here, and Alkali was coming. But due to the heavy rain what we experienced this morning, some of them are having difficulty to get to the hospital. But then moving forward, I just wanted to reiterate what the OIC just mentioned here, the officer in charge of the hospital, that Brikama Society in Seattle have been doing a lot in this hospital for the past decade. It's probably around 12 years since we started this project, to help our families and our community in this region here, to make sure that their health, is well taken care of. So as the current president of the society, we sent in some equipment, some medical equipment. I would just mention the trauma kits that we sent a couple of months ago. These trauma kits, are worth $1.1 million. And of course, the donors, we get this trauma kit through one of the hospitals in Washington State. That's St. Joe's Medical Center. The lady that helped us, her name is Cheryl Saxby. you know, through her and through, you know, the hospital associations and through the physicians, you know, whenever we get a list of equipment that we need from Brikama, we send it to them, and then they will deliver it to us, and we will ship it to the Gambia. So we want people to benefit from this. This is not just for Brikama alone, it is for Brikama and the surrounding. Or just like the previous speaker said, you know, it is for the entire country. Somebody could come from the end of the country and have an incident and come to the hospital and will be treated. So we are very, very grateful for what we've been doing here. And also we are grateful for our partners, because, you know, we see that, you know, like the OIC mentioned, you know, when we send in the PPEs, they got here right on time, because at that time they were very short of gloves. You know, we all know that, you know, healthcare workers cannot go without gloves. Those are the first things that you can have on before you even attend a patient. So, you know, I think that's great that, you know, they are benefiting from all these things. So we are also very, very grateful that, you know, we are working with these folks. So, you know, I don't think I have much to say, but just to thank our partners here, and also to thank our donors, you know, in the U.S., you know, that, you know, we cannot thank them enough. This is great. And also our executive and our membership, you know, I'll extend the request that has been made by the OIC, that they wanted us to extend our solar facility, our solar panels throughout the hospital if we can, so that, you know, all can benefit, not just for few wards. I'll extend that to them, and then we'll look into it very, very seriously, because, you know, as a healthcare professional, I don't think, you know, this hospital should go, you know, without electricity. You know, that could be so disastrous, you know, and, you know, we will do our utmost to make sure that, you know, throughout the hospital, you know, there's electricity supply, you know, because when we have this solar here, you know, we will make sure that, you know, when there is no electric power, because nowadays we're in the rainy season, you know, just last week, you know, even me, I experienced it, that, you know, we had a major windstorm. You know, it made a lot of damages, and then there was a power shortage for 3 days. So could you imagine someone on, you know, in theater, and they don't have power? You know, how devastating that could be. So we are aware of it, and then we are definitely going to be very, very serious about it, and make sure that, you know, we lead the whole hospital. Obviously, we're going to do that. And, you know, and one of our members also just arrived, you know, Mr. Lamin Jata, you know, he's commonly known as Sibi Karang, you know, he lives in, you know, he's a Brikama citizen too. He just came from Seattle a couple of days ago. So on behalf of our society, Brikama Seattle Society in the U.S., like Mr. Fatou just mentioned, you know, I would like to urge all Brikama citizens, you know, in the diaspora, not just in the U.S., but in the diaspora, to know that, you know, this association we have in Seattle, you know, it's a 5013 association. It's a very, very strong association that anybody in the world can join in, can donate, can support, and make sure that, you know, our healthcare is taken care of in this, you know, in this town here, or in this community. Because even me here right now, I'm here. If anything happens to me before I go to any other place, this is the health facility I'm going to visit. And I'll be very, very proud that, you know, the things we are doing here are going to be, you know, helping to facilitate my health. You know, so on that note, you know, I would definitely urge, you know, the Brikama citizens, you know, that are going to watch this televised presentation, to urge their citizens, to urge their kids, you know, their children that are in the diaspora, either in the U.S. or outside of, you know, America, to reach out to us, to know that, you know, Brikama Society, we have a page, we have a website, it's called BrikamaSeattleSociety.com. You go there, you'll see our activities is well, you know, publicized. You know, you will see everything there. Even if you want to donate in cash, you can do it through that, you know, website. You know, if you live outside of the country, you can do it. So we are urging everyone to please join our society. You know, we are based in Seattle, but it is for every Brikama citizen or every Gambian citizen that think that, you know, you can support this cause, to make sure that, you know, we have the best health facility in the country. All right, thank you so much, and then I'll hand the mic to the chairman.
Yes, so I would like to invite the representative of the regional director, Madam Rose Jallo, to also say one or two words.
Good morning. Thank you all for giving me the floor. I am Rose Mendi Jallo, the regional senior nursing officer, acting on behalf of the regional director, Mr. Samate. I'm very, very pleased and honored to be part of this occasion today. It is indeed a blessing to the people here in Brikama and the surrounding. As we all know, Brikama is a place where people all from different parts of the country visit to seek medical attention. And within Western region, Health Region 2, we have about 39, but 37 are reporting health facilities that all seek medical attention here. It starts from Fatou to Tanje, then to Katong to Sintet. So you'll see the distance that Brikama is covering is huge. And even some people also come from the Combo North to also seek medical attention here. So your society is a great society that people all have to emulate in the general population, because you are not only helping the people of Brikama, but is the general population of the Gambia. And seeing your input in this health facility, it has created more opportunities for more women to come here, deliver safely, and go home safely. Because after your renovation, we have seen a great impact on what you have done in that unit. Most women come, they deliver safely, despite us having a number of maternal deaths. That doesn't put us to the level to say we will not work very hard towards implementing the maternal health goal. So as a region, we are very pleased to have you people in supporting the Brikama District Hospital in all ways. And especially with the coming of the solar panel installation, it will add more value to the health facility and the population at large. Because we have been having a lot of erratic electricity interruptions all the time. Sometimes even it will even urge the ops and gynae team to refer most cases. But if the installation of this solar panel is being done here, it will add more value, and we will be seeing a great number of deliveries taking place and also quality of care being rendered in this hospital. Despite all the odds that we are facing in this health facility, we are still doing our best, and we are not being let down because of your commitment to the achievement of the medical and health goal in this country. We thank you all, and we urge all the Gambians who are from this community, from Brikama and elsewhere, to also emulate you people, because you have done a great role in achieving our own health goals and for the entire Gambia community. You might be seeing it as a small thing, but we do not see it as being a small thing, because we have known what you have done. Even bringing these trauma kits, the N95 masks, and the surgical gloves, it is a great value to us, because in the past months, we have not been receiving gloves from the Central Medical Store. But you bringing this at this point in moment, especially we are in the rainy season, a lot of accidents occurring, a lot of injuries occurring, a lot of cases happening in the health facility. We will be able to utilize these goods that you have sent. And it will not only end here, because the traumatic kits can only be sent also to the Edward Francis Teaching Hospital for them to be utilized there. We will not keep them here, because we do not have a surgeon whom you know that, or an orthopedic who will be able to use these kits. But we will also render these services to our own community people in Banjul. We thank you all, and we also pray that you people will also take this message back to your society, that we are very, very grateful for what you are doing for us in the Gambia here, in Brikama District Hospital in particular.
Good morning, Mr. Chairman. Good morning, Mr. Chairman of Brikama Seattle Association and the delegation to the OIC, the Principal Nursing Officer, Health Region West Coast 2, and my fellow colleagues here present. We are delighted today to grace this occasion, and I am an old staff of Brikama, because before the coming in of Brikama Seattle Association, I was privileged to be working here since 2005. But one of their major impact that they have done to the community and the hospital is the renovation of the maternity unit. Because I was a practicing midwife in 2012 to 2016. I was working in the same maternity, but when it's raining, it's just like we are standing at the outside. It's just rain on us. We are delivering mothers with their babies, and it is raining on us because even the pans, the number of pans that we put inside the water cannot control the water. So when they come in, I came back here in 2019, and then I saw that I was so delighted. So maybe those people who are not privileged to see what has been happening before and before their inception would know. But we who were here before, we know what they have done. And numerous other activities. If you go to the adult ward today, you see the bed, the nurses will sit and just have a remote and switch on the remote, the bed will uplift itself. So it will help us, our care, because lifting patients is another problem, but we don't have the facilities. All the beds are replaced with the new ones, and then we also urge them, as we are here, we are privileged to have you. So any problem we have, we will put it across. The beds are so useful. We would love the beds to be full of the adult ward, because if the adult ward have all that type of bed, lifting patients will be very easy for our staff who are working there. And all other activities. And we also assured you that all the equipment, the instrument that we are bringing to Brikama District Hospital will be put into good use. We are also part of you. We are part of the community. We are living here. Our families come to this hospital. We also want the hospital to be upgraded, to have everything that we need. So we assured you that all the equipment that we are bringing here will be used put into good use, and then we will be responsible for their upkeep and their maintenance, inshallah. So on that note, on behalf of the staff of Brikama District Hospital, we thank you immensely from the bottom of our hearts. We are grateful, and we hope that this association have so many of its kind to have to come to the aid of Brikama District Hospital. Thank you so much.
Can you tell us what are some of the equipment that you donated to the Brikama Health Center today?
So I will just give you a brief history of Brikama Society that lives in Seattle. We've been in existence for a little over a decade now, and our main focus is to help our communities in the Gambia, especially in Brikama and the surroundings, for their health benefits, right? So we've been sending a lot of equipment here, starting from hospital beds, mattresses, washers and dryers, to wash patients' clothes and also dry them. And also, the mortuary freezers, we also sponsored that also. We bought about 4 freezers and sent them to Brikama Health Center. So currently, or recently, we just sent in some trauma kits. These trauma kits are used for very trauma situations in case of when people are involved in serious accidents and they have broken bones. So these kits are used to fix those trauma. Some of these kits, they have saws, they have screws. They have a lot of equipment, and the equipment we sent, they are worth $1.1 million US. And also we send in a lot of PPE. So when the coronavirus hit the whole world, our main concern is the Gambia, more specifically Brikama and its surroundings. So we make sure that our community, we do what we can for them. So we send in a lot of PPEs, from gloves, gowns, masks. You can even see here we have N95 masks, to make sure that our people don't have those shortages, going to hand sanitizers and all those stuff. So that's our main focus, to make sure that our healthcare personnel in Brikama can have the best equipment for their work.
Okay. Recently, the Brikama Health Center have been criticized of lack of negligence, especially when it comes to helping pregnant women in delivery. What are your association doing in order to help them in that aspect also, so that these pregnant women can deliver here easily without any one of them being harmed or died during labor?
That's a great question, and that's a great concern to every citizen. Not just Brikama folks. But in that aspect, we, even before all that, women's, Gambian Women's Life Matter comes out, we were focused in, refurbishing the maternity ward at Brikama. We did that. We finished it some months ago. It is well refurbished and well furnished. We put in beds there from Brikama Society, beds. And they have, some very good electricity supply there. We even provided them with television sets so that, the patients, at their leisure time, they can be watching TV and know what's going on in their surroundings and globally. So that's our concern. I know childbirth, maternity, it's been a big concern in this country, not just Brikama alone. But for us, so far, we are just focused in Brikama Health Center or Regional Hospital. We're going to do our best. And, currently, we are even, we started installing solar panels to make sure that, they don't go out of light, because when the electricity goes off, we want to make sure that, their solar can kick in and they have enough electricity to take care of their patients. So that's something that can also prevent a lot of deaths, because, could you imagine if a mother is in labor and then electricity goes off, how devastating that could be to the caregivers and to the patient and their families. So this is something that that worries us a lot, and this is something that we are always thinking how to help. But we're gonna do our best. We're gonna do our best. We work with donors, in Seattle or in Washington State. These donors, they help us. They are the ones that even help us to build this, to refurbish this maternity ward. So we are definitely working tirelessly to make sure that those childbirth death is controlled in a way that it's not going to be as bad as we've been seeing in the past months and years.
Okay, what message do you have for other people from Brikama living in other states, whether in America or they are living in Europe, Asia or other countries, when it comes to assisting the Brikama Health Center with equipment that will help them to deliver their services accordingly?
That's a great question. I mentioned that in my speech earlier when we were doing the presentation. We are urging everybody that is watching this interview here. Either you are from Brikama, either you are born in Brikama or live in Brikama, or your parents live in Brikama or not. But if you associate with folks from Brikama, please join our society. We are based in Seattle, but what we did this year when I became the president is to globalize it. In that sense, globalizing is, we're reaching out to folks that are from Brikama and the surroundings to join this association we call Brikama Seattle Society, to join us and be part of us in making our community's health the best in the country. Because I know that Brikama, even folks from Basek, come to Brikama here for treatment and stuff like that. Because before you pass here to go to Banjul, I think sometimes, they will stop here and get a treatment. Unless it is worse, then they can be referred to Banjul. And we're going to be working so hard to make sure that, the buck stops here. People don't have to travel all the way to Banjul all the time, because I've seen the traffic, the hecticness of traffic in this country, or especially in the combos, is so terrible. Imagine you have a patient that you can even save his or her life within 20 minutes, but it would take you over 2 hours before you get to Banjul. That patient could die. So those are things that we are trying to avoid. That's why we want to make sure that we have the best for the Brikama Regional Hospital. And so we are definitely urging everybody that is going to be watching this video here to share this to their families that are outside of this country, either in Europe, Asia, or America, to reach out to us. Our website is BrikamaSeattleSociety.com. You go there, you can access us very easily. You would see our logo, you would see everything that we've been doing here. Everything is there. Even our meeting minutes are all captured in that website. Our donors, you can see everything there. Even if you want to put in some money there, if you live outside of this country, it's just like a swipe of your debit card, you can donate into that society. So we are urging everyone to join us, and we are urging every Gambian to also emulate us and see that, as the saying goes, a healthy nation is a wealthy nation. So we want our people to be healthy. We live in the U.S. We thank God. I thank God. I have a very good insurance. When I am sick or my family is sick, it's just a matter of you just drive, or you call the doctors, they would advise you what to do, or you go to the hospital, you are well taken care of. So we want the same things for this country, especially Brikama and the surroundings. We want to make sure that, they are well taken care of. We want to make sure that, when their families are sick, they don't have to have a second guess either to come to the hospital or go straight to the pharmacy. They would know that, there will be some support for them here, so they can just come to this hospital here, which is the Brikama Regional Hospital, for proper care.
Thank you so much.
Thank you, and it's a pleasure having you here, and I thank all the media houses that have been present here. Thank you, Kerr, Fatou.
Okay. We've seen the Brikama Seattle Society donating medical equipment to your institution. How would this help in your work regarding, health issue in the country, especially people living around Brikama who always comes to your institution for health needs?
Yeah, this is something that I'm really very happy with. It's come at a time when we definitely need it. We all know we are in this pandemic period. And then if you can see the items they brought, these are the N95 masks, surgical masks, disposable gloves, and they have surgical gowns as well. And these are all materials that is needed during this pandemic period. And then we can also see they brought some trauma kits. These are for trauma patients, though we don't have orthopedic in our facility, but we are trying to make engagements to see if Edward Francis Small Teaching Hospital can have these materials, because they have the specialists who can use them. But as I said, these are things that are used to at least prevent healthcare workers from getting certain infections, especially this pandemic period, and then it is really worth it. I really thank them for at least honoring us and then looking at us and giving us assistance in many areas.
Okay. Looking at donations of this equipment, are you foreseeing more of this kind towards your institution in the future?
Yeah, as far as this Brikama Seattle Society is concerned, this is not even the first time they've been donating the district hospital. I think they had a long-term relationship with the hospital, and they have been doing in many areas. Since I took over office, I have received at least washing machines and dryers from them, and 2 each. And then I have also received gloves from them before this one. That was some time ago, which was really also very helpful. And then they are also in a solar project for the facility, which about 55 panels are already up on the roof, which work is going on to fix them, at least to ease up the electricity problem, especially in the labor ward and the operating theater. And they've also assisted in the mortuary area, because they brought a fridge for us at the mortuary, which is for Kimbat, which is helping the general populace. And so I'm foreseeing that this relationship between us and them will continue, because one thing is, if you are giving me something and at the end of the day you are not seeing it or I'm not using it, that can be my fear that it will go. But any time you see when they come, things they give, they always see them, especially the physical ones. But the consumables, yes, of course, we will use them. That one may get finished. But at least we have a recording system when they give these things, which are recorded, and then there are proofs to that. So I believe the association, in fact, what I would say is I will advise others to emulate this association, because I think the association is there to stay. and is there to help the Gambian people.
Okay, Brikama Health Center has been, criticized for so long by so many social commentators, especially when it comes to pregnant women delivering here. Do you think the help of helping Brikama Health Facility to be equipped will, reduce those maternal mortality or other health complications when it comes to, delivering the service according to the needs of the people?
Yeah, in the society, when you are doing good or you are working for the public, not everybody is there to clap for you. Some must criticize you, and which I believe you should welcome, because those criticisms are paving ways for you to improve on maybe your weaknesses. I really appreciate that, but I also want to say this to the general public, that when you are criticizing, please criticize on the right part. Most of the criticisms on Brikama, most of them are not true, because I have proofs to all that. They will take pictures somewhere and put it on the Facebook. They say Brikama, and when it is not Brikama. And many times I have seen that. But it is not my duty to challenge them on the social media like that, because I have an authority. I am an authority here, but I also have my supervisors. If actually these are the realities, my supervisors would have asked me. But some of these things are not true. And yeah, it is true, it's a government institution. We also have our hinges here and there. There are sometimes shortage of certain things. This is why we all know government cannot do alone. So this is why other partners need to come in and help, like Brikama Seattle Association. But yes, yeah, like the pregnancy and pregnant mothers we are talking about. My brother, if you look at our statistics today, I'm just coming from there with these Brikama Seattle people. Our statistics is growing, the number of deliveries is going. 2020, we deliver over 7,000 babies. That tells you what? People admire what we are doing here. Yeah, so this is the fact.
So compared to other health centers, Brikama is too big, and then a lot of these surrounding communities normally comes here. So compared to the health, the equipment of Brikama Health Center to the likes of Kanifing and Banjul, Banjul is the main. So how would you want Brikama Health Center to be like in the future?
Every institution needs development. Every institution wants to grow, and every authority wants the institution to grow. And this is our sole desire for Brikama. The facility, there is need for the facility to grow, there is need for the facility to develop, to be developed. Serekunda, you are mentioning, and Banjul are general hospitals. Brikama is not a general hospital, it's a district hospital. There are certain things that are needed that we'll be happy to have, but we still don't have it. But I am really sure that this is in government's plans to get a hospital for Brikama, and then hopefully very soon Brikama may have it with the plans. That is my hope. But there is great room, there is every room for any other person who feel that you can come in to help Brikama to improve situations here. You are most welcome. Brikama is for us, it's for Gambians and non-Gambians, because non-Gambians and Gambians come to the clinic. So it's for all of us, whether you are a Gambian or non-Gambian, you are please welcome if you have anything to help.
Thank you so much.
Thank you very much. Thank you.
In communication, connectivity is everything. We ensure that the links never sleep. Quantities and qualities, all in our data service, providing efficient, reliable voice and data service. We believe if you're not up to speed, then you're going backwards. Communications have to flow as fast as the speed of light. Whatever business you're in, having someone who understands your needs is critical. That is why we just don't offer you technology, we offer you solutions. Enjoy Gamcel's internet broadband anytime, anywhere. Your national operator, Gamcel, Yaibaram.
agada
mbijan raganyadi
albaka
mbaka important
yo nga transfer la sto
ya transfer la
ha code nyinji
okay nsila id soto
sa soto sorry agada
mbijan bro
albaka
mbaka
bara alla service o tariya
bare
ki janna nun kunu bara tariya
jannom yona forest de bureau gambia tonkon nano mbali ya bere birin koyna fo kato
bari si kodo kino kato nim fo bolon labe
56 branches mola soto gambia jam
ha
gambia kono ani gambia bantala bankol nko kodo kiya bere kodo sifa fo falindiro fo nyaadi lafta memmen na kodi topoto nin kodi maraw jannom number 1 ti nyonta andum fana nata anoda enterprise sotale wolam nyindi ko domorol fana kol fana be firale de dadi mani domorol dil fana beteat gambia dawda yalo ngam fa kendol sotale je
wo moyo diat
apelenta
baraka ni na lafta nyelen kendol e bina
yalo bu kanila ko la baraka ba
yalo ndel chosano lo
baraka
yara nyilla domoro ka diata
boy janno sikes restaurant
sign na ko be ni na dimbal nimba domoro kala janno
domoro seneyata adiyata topotoro fanan kende ma bije luntan during tamala abeka domoro ki janni adi manda wala de te ka we bijele anim fanan ka fadi jang ikono e fa e ka fa minne ko pastry anim bakery iko fanan be kalele badde lomba conference lomba workshop lomba ye fo pendin lo dunia kono domoro betama nyillom international o tewoda number 1
amanke ba domola jandama
esa domo jang is atariya
wo mu kubandi
sa na ko sa futandin
oto sa na ko be mu CK's restaurant
dafa nan janna mu yat ni manje dorom bijam
aban
CK's restaurant, known for best quality food and customer satisfaction.